Hi, everyone. We'll get started here in about a minute or two yet, so give some people some time to get back on and get settled. So thanks. We'll be right back in a minute or two.
Hey, Matt, just so you know, it's Gary Antonon.
Oh, excellent, Gary. Thanks. We'll be starting here in about 30 seconds, I'll say.
No problem.
Is the governor on? So we'll kind of see when we'll be watching for the governor to come on too.
You might not come on, Matt, because I think there might be a press conference going on in like 15 minutes, half an hour.
Okay.
This is Governor Ricketts. I'm in the meeting.
All right. Excellent. Well, let's go ahead. We'll go ahead and get started.
I'm going to go ahead and mute myself while you guys talk.
Well, and we'll go ahead and start, and then you'll be right up next, Governor. So, hey, so welcome everybody.
Okay.
I wanted to just briefly say thanks for everyone's hard work. There's been a lot of moving parts yet this week. On the slides, you kind of see the quick agenda. We'll go from me to the governor, and then comments by Gary. And I want to talk a little bit about the public health broadly around the state, and then I'll kind of dive into some details that I know from the education side. I put this slide up here, Fred Rogers quote that says, "When I was a boy and I would see scary things in the news, my mother would say to me, 'Look for the helpers. You will always find people who are helping.' To this day, especially in times of disaster, I remember my mother's words, and I always am comforted by realizing that there are still so many helpers, so many caring people in this world. And what I'm going to tell you, I think it's a really critical moment in time that our families, our communities see our schools as those helpers. So thanks for everything that you're doing. I know it's chaotic sometimes right now, but I really believe that we'll be able to move forward as a state, protect the public health, and be able to do that work most effectively. So once again, just thanks. Governor, I want to turn it over to you for any comments and things that you want the group to know.
Great. Hey, well, thank you very much, Matt, and I appreciate it. I appreciate your the way you're starting it off, because I think that's exactly right. With this public health emergency, it's an opportunity for all of us to, rather than react with fear, react with how can we help our neighbors? Who are the people that need help? How can we reach out to those folks? And so that's what I would encourage all of us to think about. This past week was an eventful week again, where we had the directed health measure by Douglas County, and then from the state for, as I had talked about before, doing it by ESU. So we did it for the Omaha area, so ESU 19 and 3, so covering Douglas, Sarpy, Cass, and Washington counties. And that is going to be in effect till April 30th. And as part of that directed health measure, obviously, before, I know some of the schools had talked about operating without students at least till the end of the month. And so with this, it'll mean at least in those two ESUs, the schools will be operating without students till at least April 30th. I say at least April 30th. If we do see an abatement of the spread, it's possible that it could be less than that, but I really don't want to promise that. I would say more likely it's going to go longer rather than shorter. But we will reevaluate. We will work with the folks at UNMC and keep an eye on how things are going. And if it looks like things are getting better, then we might pull that back. But I'd rather under promise and over deliver. So I wouldn't really count on that right now. But we're going to continue to monitor situations. And just, again, a reminder, we're going to take this on a geographic basis across the state by ESU. So if we have a case of community spread, which means one of those cases that we cannot determine how they got it, then we would look at that ESU and issue the same directed health measure, which would be more restrictive, like it is in the 4-county area I just mentioned, than it is in the rest of the state. We have received confirmed coronavirus cases in places like Adams County, Buffalo County, Knox, Nemaha, but all the ones we have discovered so far are travel related, so they're not that community spread case. We do have 2 in Lancaster County now, but again, they're travel related, so we can trace those. But I would say that it's probably likely that we will get a community spread case in Lincoln in the not too distant future. I can't tell you when, but that seems likely, and in which case we would do a directed health measure for Lincoln. Depending on, again, the case, it would be 1 or 2. We would issue the same sort of directed health measure in Lincoln that we've issued in the Omaha area. So it's, again, it's a rapidly changing situation. We're going to continue to monitor it. I just want to say thanks to everybody on the call for all the great work that you all are doing to continue to, work with your parents and your students with regard to how you can figure out continuing education, how you can operate without the students there, and looking, to be able to help us in other ways. I mean, one of the areas that we're going to be soliciting help is for childcare. We know that our daycare centers are being impacted by this as well. We're going to be looking for ways to try and expand the capacity for that, especially for our first responders, our police, firefighters, EMTs, and our healthcare workers. It's important that we make sure those folks can continue to go to work and keep the public safe. So that's what the kind of things we're going to be focusing on. And I guess from the state standpoint, we'll also be looking to continue to focus on protective equipment and how we can get more of that here in the state, how we can expand testing, and how we can continue to build out our hospital capacity to handle more cases down the road. So with that, Gary, maybe I'll ask you to just comment on the current state of how many cases we have and what we've been seeing out there.
Sure. Thanks, Governor. This is Gary Antone, Chief Medical Officer. And currently in the state of Nebraska, we have 48 confirmed positive cases. There is a little bit of a discrepancy as far as, I think the Omaha World Health reported 49, but one of those cases was actually in Knox County that was diagnosed from the South Dakota Public Health Lab. So that's why you see 49 in the World Herald and 48 that we've tested positive here in Nebraska. So those include mainly Douglas County, Sarpy-Cass, Washington, Lancaster, Knox, Buffalo, Lincoln County, Nemaha, and Adams counties. There has been 2 counties with community spread or community acquired cases, Douglas with 2 cases and Sarpy-Cass with 1 case. And that was the reason for the directed health measures in those counties. Overall results, we have tested at this time, as of this morning, 8 o'clock this morning, a total of 952 Nebraskans have been tested. And of those, as I mentioned, 48 have tested positive. There have been some inconclusive tests. We are treating those as positive, their investigations done by the public health labs. But even with that said, even with 48 out of 952 tests, we're at less than a 5% testing positive rate, which is obviously very encouraging as far as testing only the highest of the highest risk cases up to this point, and still only having about a 5% incidence of testing positive. As the governor said, we're working very, very hard to expand testing. Right now, there's all sorts of different testing mechanisms in place, but the ones we've had in place up to this time and are working are with our Nebraska Public Health Lab, which is at the Durham Research Tower in Omaha, right next to the University of Nebraska Medical Center. The University of Nebraska Center Medical Lab also is doing their own testing. And then we are also sending out tests to commercial labs, LabCorp, and Quest Diagnostics. And we're getting those results back now. Even though the turnaround time for the commercial labs is longer than what we see for both our labs here in Nebraska, we're starting to get some results back from those labs, which is very encouraging. And I think that's going to help us out in the future. Our public health lab is considering doing what's called pooling specimens together, since the number of positives compared to the number of negatives we have are obviously in favor of negatives. They can pool samples together. They're trying to pool maybe 5 samples in one so-called test tube, and then testing all 5 together. And obviously, if all 5 test negative, then we know they're all negative. If there is one out of that 5 that tests positive, or 2, they'll go back and separate those out and test them individually. But that should get us up to a testing capacity, at least with our public health lab, of maybe close to 400 to even close to 500 per day at the capacity. The rate limiting step up to this point has been getting the reagents that are needed to extract the RNA from the actual sample from the patient. They're called extraction kits. The World Herald had a great article in the paper today, and it explains the process about the best I've ever seen it. So they do the extraction of the RNA, and then they run that extracted RNA sample in a polymerase chain reaction machine, which also takes reagents. And those 2 steps, the extraction and the actual run on the polymerase chain reaction machine, have been the reason for limiting testing, because the reagents have not been available. So we're hoping that the reagents will become much more available as days and even hours go on, and we'll be able to expand testing. We want to also expand testing to those commercial labs, and we'll be doing that too. So there's also something mentioned about a machine called the Cepheid machine, which might also be able to do testing here in the near future. And I'm talking to my laboratory experts on our team. Most of the major hospitals in at least metropolitan Lincoln area and even maybe rural have that type of machine. So that will also be able for us to expand testing. But up to this point, we've tested mainly the high-risk patients, people that have been from high-risk travel areas such as Europe and Asia, and maybe some of the 3 hotspot areas in the United States, such as Seattle, Northern California, and the New York City area. And if they develop symptoms, they will get tested. We also test any high-risk patient that has pneumonia in any of the hospital systems that does not have a diagnosis. And then we test people that have been close contacts with those that have tested positive. So just to break that down, 25 of our positive cases have been from just travel-related areas. About 14 have been exposed to people that have tested positive. So only 3 community-acquired cases at this time, which is just an absolute tribute to our public health departments, our local public health departments here in the Nebraska area to make sure that we've kept the spread down up to this point. So I think I'm going to quit there, Matt and Governor, and go ahead and let Matt take over.
Yeah, and thanks again, Gary and Governor, both for those insights. Hey, I know I put a slide up here that also has kind of what Colorado is experiencing. And just because my dad lives in the county of Budding, Colorado, I'm paying kind of closer attention out in that area. One thing, I know they went from about 70 cases to about 475 yesterday. So in 1 week's time, they had that type of growth. And I'm curious because I know Pat Lopez, if you're on, I think I understood that one of the linking cases was actually associated with Colorado. Is that accurate? And can you give us a little update on that one? Pat, you might have to hit *6 on your phone if you just dialed in too. I think we can hear you maybe.
There. Can you hear me now?
Yep, sure can.
Oh, Good afternoon, everyone. Our first case was a man who had traveled to Colorado, to Denver, and became ill after he returned. Unfortunately, had limited contact with anyone after he developed symptoms. But as we've seen happen in Omaha and other areas of the state, now there's a close family member who is also positive as of yesterday. We're continuing monitoring here. We have some tests pending. So that's what's happening in Lincoln right now. And of course, we're looking forward to having more testing available.
So thanks, Pat. I don't know if Kim Engel from the Panhandle, I know you're probably watching Colorado pretty carefully too, I'm guessing.
We are. It's very common for our folks to drive to Colorado or to Wyoming. That, you know, we're very close. And actually that was one of the triggers for us when our schools in our ESU 13 were debating to close or to stay open. We had gotten a notice from the Department of Colorado, the health department, that anyone who had been to the ski resorts in that last period of time were going to be asked to be quarantined. And if you look at the cases in Colorado, like you said, there's 475 now, and the majority of those are from the Denver area, which is 97, but right behind that are those ski area counties. And so it's really picking up there. My son happens to be an intensive care unit nurse here at Regional West, and he keeps in contacts with his colleagues across the state line. And just a couple days ago, a nurse he knows said that they felt like they were about maybe a week behind the Seattle numbers that they were seeing. So they're ramping up, converting their PACU beds to ICU beds and preparing. So Colorado is a big interest to us here in the Panhandle.
So yeah, thanks Kim for that, because kind of watching that, I don't know if any other I think we have most of the other local health directors on, but as I kind of keep thinking about this around the state, in fact, I just found out from my daughter that several of her friends last week just came back from Colorado. So I know it's probably just our travel patterns with Colorado is probably something curious anyway to watch and be thoughtful about. And I think it's for us just kind of keep watching those things. I'm very curious what the local health directors, as you're having conversations, I know with our ESU or by ESU region, obviously those have been very productive conversations, and I appreciate that work very much. In fact, I'm going to kind of dive into my presentation a little bit. I know we're getting a few questions. I don't know if we'll get to all the questions today, but I wanted to remind folks of their public health regions around the state. So I've got a map up there. Again, it's not perfectly aligned with the ESU boundaries, but it gives us good communication. And I think we probably all said we've been communicating a lot more than we ever have before, and I very much appreciate that. I can show you. You can look at this. And by the way, we'll send out the slide deck so folks can have it. If you happen to be on the phone, we'll put it up on the website or something so you can download it. But the ESU regions obviously have been critical for us making calls, as the governor said, about officially making decisions to close down areas of the state. Obviously, a lot of schools have switched to a different type of operation already from our school perspective. I'm going to want to talk and keep talking about that. Obviously, I've had some school folks call me and say, well, is it next week we can open, or the week after, or when can we open? And if there's not some type of the DHM to have the governor close it, what advice do you have, Commissioner? And so I'm going to give you some advice as we keep going through this slide deck. Obviously, those health regions are important to us, but those conversations, and again, I know ESU by ESU and area by area, I know at least you're having those meetings once a week, and if not twice. And we're all getting better at Zoom, I guess, is what I would say these days. So I'll see if I can. There we go. So here's my topics for this briefing, and I probably hit the headline one here. Really, my recommendation on school operations. Number one, we're trying to work on a strategy where we would identify what the continuity of learning opportunities through the remainder of the school year would look like. And I'm going to say, based on the data that we have, even optimistically, if for some reason we were able to get back to school, I'm actually concerned that preparing that way might be problematic for all of you. I'm hearing from you and a lot of different schools going, some sense of direction on what we think and what our best guesses are right now. I would be in a best guess mode right now that watching the state scenario and watching other states and our role in public health, right, ensuring that it doesn't suddenly start to spread, probably means staying in this environment for the rest of the year. And so I'm just going to tell you that schools must be prepared to operate in this alternative learning environment, meaning without students in schools, I would say through the remainder of 2019-20 school year. And I know everyone, me included, wants things to happen for our students, graduations, everything else. But I really think if you start to look at the data and the concerns, we're unlikely to be in that situation. And I don't know a better approach than us trying to be, I think as the governor said before, how to be, maybe more conservative than he is. By the way, that's a good bumper sticker, Senator or Governor Ricketts, if I could say I'm more conservative than you. So I think that's kind of where we're at on trying to do this and be thoughtful about what those next steps are. That actually helps us set up kind of where the guidance would come from the department in the long run, and ensuring that schools are really part of that big public health push. I am concerned that there are kind of areas of the state that don't think it's a serious issue yet. And maybe for them, maybe it doesn't seem like that, but I'm actually pretty concerned with our I-80 corridor and probably our traffic patterns in the state that number one, we be in a position at least to be part of the solution, especially as we can continue to offer educational opportunities across the state. And so that's pretty much where I'm at as far as that recommendation would go. And we'll have more conversation in the next probably, well, through this today, but also try to get more information out to all the schools from this presentation today. Obviously, we're looking for learning opportunities for all students, regardless of a lot of different equity issues. And we'll talk a little bit today about special needs and poverty, English learners, and technology gaps and other things. Not that we have all those things resolved, but there's a little bit of breaking news on some of that, especially as it relates to special education. The concern around food security and school meals is on the list of things to cover today. Accountability and assessment, which I think you all know, but I wanted to make sure that you had a good sense of that. I'll just remind folks, please mute if you're unmuted so we can keep going. Our public, I want to also address some dynamics around public gatherings and workplace conditions. And Governor and Gary, if you're still on when we get to that point, I would love some of your insights on that too. So, so first of all, our continuity of learning plans, we'll be working, in fact, tomorrow, having work with a lot of, and invited, I think, the whole state to participate in a conversation around what continuity of learning looks like. Kind of in simplest terms, we'd be looking for kind of establishing a planning phase for how you're serving your students generally, and then how you're serving students with equity challenges, including special needs. I think it's going to be important to think through what that looks like in an immediate sense, and we don't want to slow schools down. We want you doing what you've already planned and began working on. We know that we'll kind of enter an implementation phase that might very well be the rest of the school year. So if that for you is that 4 to 8 week or 6 to 8 week time frame, or a little bit longer possibly, implementing that approach is going to be important. And then I put on here, hey, look, if there is some chance to return to normal operation, as the governor said before, we're going to keep watching that data across the state, and that would be a wonderful gift. But I actually write on here that I feel like that's unlikely given what we know right now. So I think it's important that we message to students and families that it may very well be that many of those routines of a normal school year would come together. And then basically in the end of the year, we're hoping that to kind of define or have folks be able to fill out very simple reports on how you're able to meet those various assurances. We also need to know, just like we've talked about with Rule 10, places that obviously if they're not meeting their hours and whatnot, I think I can say that the state board and I have had many conversations that we're doing everything we can. We know this is the most unusual of circumstances, and even I credit the governor for offering up any of the emergency provisions that he has to allow us to waive possibly any rules that we couldn't otherwise waive. So I know and I hope that in 2021, 2020, 2021, that doing some of the planning for that school year is part of what I'm hearing from schools. It's hard to be planning a new environment and at the same time also thinking ahead to 2020, 2021. But again, I just put that kind of on the list of where we hope to go and be talking about in the days and weeks ahead here. So again, like I mentioned, there's a continuity of learning Zoom tomorrow, and we're obviously aware of a lot of different partnerships taking place to help provide kind of bridges to gaps that are taking place in the classroom, but ultimately put us in a position to essentially share our experiences and efforts across the state, and hopefully be able to help public, private, or exempt schools. I would even say we have Rural 18 environments, youth, our places like our YRTCs that have residential settings for students, and trying to figure that out together probably over the next couple of days is going to be important. I would even say on our Rural 18 school environments, including Boys Town and otherwise, we're planning to have a meeting to discuss that and further discuss that those situations as well. So there's a lot happening, and we'll continue to kind of push through with some of those learning plans. So I do want to say that the special needs portion is really important, that the ensuring we're able to kind of, I keep saying thread the needle on dealing with the requirements underneath IDEA and provisions for free appropriate public education, or FAPE. One of our key aspects is gathering stakeholder input. You know, we are in a process where we've never been before, and I think even in conversations I've had at a national level and also at a state level, gathering some of those key folks together and not physically, but probably over Zoom, is going to be important. We have an approach that I think we got new guidance last night that maybe starts to lean into our approach that I've thought was important, that we've tried to provide very clear guidance about what will happen in Nebraska. I know a lot of schools and talked to quite a few of your school attorneys over the past few days, but the reality is it's going to be a challenge, but I think still gathering that initial input and working with folks to come up with clear guidance is going to be important. So the U.S. Department of Ed, when they provided this guidance just last night, roughly at 6 o'clock, we're still kind of poring over that. The NDE will continue to work with you on those fronts, but and in particular, trying to provide that clear guidance as it relates to IDEA is going to be important. I placed this up here just because I think you have access to this guidance, and if you don't, we'll make sure that you do. But they submitted a release supplemental fact sheet on particular things. I would love folks to read that and try to understand every nuance of it. It's about 5 pages long, but on their very first page, and I'll just share this with you, it put a bold statement here. It says, to be clear, ensuring compliance with the IDEA Act, Section 504 of the Rehabilitation Act, and Title II of the Americans with Disabilities Act should not prevent any school from offering educational programs through distance instruction. I think what the hue and cry has been around the country is that there's some concern that if you can't do it perfectly to address FAPE underneath this unique moment in time, that you shouldn't do anything. And I think I won't even say reading between the lines, reading specifically what they're saying is don't do that. At the same point in time, I think there's other challenges that school districts are probably going to face. But I think for us to provide leadership and clear guidance from the state is what's going to be necessary to help you get through this. And we are absolutely committed to do that. So I'll jump to the next topic, and I hate to say it's the lighter topic anymore, but I think we've already pretty well covered the suspension of summative statewide assessment and including both ACT and NSCAS at grades 3 through 8. However, I don't know if I've talked as much about the accountability side. Obviously, the assessment data is a big portion of the accountability system. Obviously, it's going to be a challenge to run that. We'll be able to pursue federal waivers on any of those accountability sides. We'll also have to talk a little bit in-state with some of our state law side of that to address those types of challenges. We would like to be able to work with ACT and NWA on allowing kind of more of a unique assessment opportunity. Number one, that our juniors would be able to take the ACT underneath our current contract, and that's something we're still exploring if it could be safely done, and maybe that's later in a slightly different environment. But also working with NWA so we can, again, someday be able to get back to normalcy where we know where our students are at and just figure out how we get there overall. And then what I would kind of add, I just don't want you to have concerns about assessment and accountability right now, and really have your focus on your students and your student needs, and your obviously and your staff needs as well. So I hope anyway that at least on the accountability and assessment side you can do that. As you might have seen the president's press conference on Friday, there's going to be broad waivers for this at the federal level, and in fact that will turn around pretty quickly for states. One additional piece I wanted to add was a little bit about just shaping learning opportunities. I mean, it's looking for kind of creativity, obviously, across the way. I know modifications to the program and calendar and employee responsibilities are part of what you're dealing with. And I certainly want to provide guidance where we can on those fronts, but mostly have you working with kind of one another and sharing best practices in those spaces, I think is important. Graduation requirements, and that's really school by school dynamics on how they're going to handle graduation. I probably or maybe think that our best approach to some of this is figuring out a way that obviously we want all of our seniors to graduate. I want my senior daughter to graduate anyway, is what I would say, and I know there's lots of those stories out there. So trying to find ways to address the equity of the delivery of services, and this is kind of the balancing act that everyone's having to do. But I do think, as you think about it, if we're with broad brush strokes able to provide instruction for some kids, other kids are going to need a lot more of our attention for a lot of different reasons, as I've talked about already, everything from poverty to English learners to certainly our special needs students. So there's a lot of different ways I know folks are doing that, including online and paper packet, but I think there might be other ways coming, and I think groups, including NSEA, trying to come up with unique ways of providing content over the air, almost over TV, and figuring out other ways that we can do that to meet the challenges that we have. I do want to kind of highlight, and just because I've seen some warnings on this, but highlight the concerns around FERPA, and maybe most so. I know there's a lot of vendors suddenly out in the field. I'm getting several emails a day of people offering free things. We have to essentially be able to do or make sure that we're. I just want to warn you that watch for those. Make sure that they're appropriate, good vendors that are going to meet the requirements of FERPA. So just be cautious in that environment. Just as I think what we're probably telling homeowners and other people right now, to be cautious of folks with the magic solutions too. Obviously with e-learning, just the concerns around equity, which we've somewhat talked again, but maintaining continuity of learning and opportunities there, using a variety of strategies. I would not be afraid of using e-learning, but you also are going to have to worry. You might have community conversations and say, well, not all of our kids can get that. How do we compensate for that? We have to understand the challenges basically that every community is going to have, and hopefully start to fill voids in a lot of different ways. Again, I just say building continuity of learning plans at the local level as best possible continues to be important, and work with partners to help fill those gaps. And we'll try to be doing the same thing at the state level. Those things that we can scale up, I'll ask us to find ways to scale up to provide for everyone. And then there's a lot of other possible partnerships. I'm sure we haven't even touched that yet. So I just ask folks to be creative to meet your local needs and regional needs. We'll be flexible on everything we absolutely can. I think our big part of this is just your students and families are going to be looking to you for guidance and direction, and I know you're looking for that from us, and we're trying as best we can at this moment. So I'll hit food security as a key equity issue, and I know a lot of you have already started this. One of the things, I think we've gotten all the waivers we've asked for so far. There may be some other things to work on for daycares, if I'm not mistaken, that we're trying to ensure are out there. But we are asking that all school districts complete a nutrition services survey. It went out on Friday, and so if you could do that. And what we need that for is to understand your food distribution plans and needs and barriers that you maybe have, so we can scale up some more supports on that front. And then obviously on our NDE website, there's a lot of information. We'll continue to use that as the place for information that you can find. So very much appreciate all those things too. So lastly on my list, and then we'll see if there's questions I can answer in the remaining time. But lastly on my list is thinking about public gatherings and workplace considerations. I've had emails and conversations and the challenges that we're seeing across the state of just understanding what the best practices really are. We certainly know that and Governor, if you're still on the line, I'd love to chat with you about this, but the reality is that there's so many restrictions probably that are so new and came on so fast, but the gatherings of 10 people or less, I thought you've done a great job of communicating that. The concerns, I think, in schools, we're starting to hear sometimes that maybe that teachers are bringing their kids to school, and maybe that's not the best thing to be doing. I'm wanting to make sure that we're talking about flexibility is happening across the, for our employees as well, and that the safe workplaces is part of our hope and part of our intention. And I know there's probably more that we'll roll out on that front. But Governor, if you're still on, is there anything you want to talk to on that front?
Well, thanks, Matt. I am still on the line. And again, what we want people to do is really think about how we are preventing the spread of the virus. And that's what the 10-person rule is really about, is looking to keep those gatherings of 10 people or more down to 10 people or less. And so we've issued guidance for a number of different industries, like the daycare industry, salons. We've told gyms outside the Omaha area they can operate with 10 people or less, some of that sort of thing. And I think when it comes to your schools and being flexible, certainly what we want people to do is use common sense and good judgment. If every teacher is bringing all their kids and the kids are playing together in groups, doing activities that are in groups of more than 10, that actually defeats the purpose of the 10-person rule and trying to mitigate the spread. So if, again, what I just asked with regard to that when you're working together with your schools, is to be mindful of that. For example, with the daycares, what we said is if you can have classrooms with 10 kids or less, and you don't have them eat common meals and you don't have them recess at the same time, then that's a way in the Omaha area for those daycares to remain open. So I would guess, or what I would say is that if you're talking to your schools, to keep the same sort of thing in mind, that if teachers are bringing their kids to school when they're working and helping to provide continuing education to other children, that they're being mindful that we don't let kids intermingle, that we're keeping them separated, and that will help prevent the spread of the virus.
So, and Governor, I really appreciate that too. I know as we kind of try to ramp back up, and appreciate the guidance for daycare providers, because one of the things I know I'll promise to work with you on anything around daycare, and I know we'll continue to try to be helpful on that front too. So I appreciate everything you've done on that. So
great, thanks.
I'll see if we have any questions that I know there's like 1,000 of them, and I don't know if I can answer all of them very well. We are asking that if you do have questions in particular, that you would submit them through our form. We'll also capture the ones that came on here, or at least I believe we'll be able to capture the ones that came on here, and keep adding to our frequently asked questions side of the equation. So what I think I'll try to do is answer a few questions that maybe have popped up. I just saw one that popped up asking, can we operate with 10 students or less in the schools? I think that's going to be a bit of a challenge in the current environment right now. But we'll kind of, maybe I'll have to look at those questions and see what they're coming up with. But there's probably a few things out there that'll probably be a bit of a challenge. Governor, did you have something? I thought I heard you start to say something. So.
Oh no, I probably just breathing too heavy into the microphone.
Oh, okay, sorry. That's right. So I probably have more questions than I can answer, and I don't necessarily. Zainab, is there any question?
Governor's questions at the beginning. You want to go?
Yeah.
First. Says like he's here.
So, Governor, I guess there might have been a couple questions you could probably help me with that popped up, if I can read them. When I need. Oh, so like one, any information for international students such as being required to travel home? Have we heard anything about that? Anything from the State Department at this point? So probably our student exchange programs, I would suspect.
I have not heard anything with regard to international students at all. Okay. I guess my recommendation would be, and this is just me, so take this with a grain of salt. I am not the federal government. I'm not the State Department. But if you've got international students who are at home with a family, that's probably the safest place for them to be. Again, if you look at the vast majority of cases that we have here in the state of Nebraska, they're either people who were either travel related, meaning they were on a plane by and large, or they were associated with somebody who was travel related. So I actually think for the near term, that is probably the lowest risk for that international student. Just stay with their host family and not get on a plane, because I think getting on a plane will expose them to a small confined environment where there could be potentially somebody with coronavirus. And again, if you're sitting next to somebody for 2 hours and they've got the coronavirus, chances are you're likely to get the coronavirus. So I would say right now, I would say that the best place for those people, for those students to be, is right with their host families.
Yeah. So, Governor, I had one question. Do we have any information about when the number of cases will peak in Nebraska? And the question asks, we've heard 6 to 8 weeks, but is that still, or between you and Gary, is that still what we're hearing, or do we know yet?
Well, let me break this out a couple different ways. First of all, as Dr. Antone mentioned, that we are, we've got tests to do the highest priority people. We are working to expand that. And so as we expand testing, we expect to find more people who are going to test positive. So I would expect over the short term, and when I say short term, say the next 4 weeks, that as we expand testing, we're going to see a lot more cases in Nebraska. The key is if we can track them all down to how they got it versus a community spread case, but I'll set that aside for the moment. But I would expect that we're going to see more. The 6 to 8 weeks really gets back to the directed health measure to really tamp it down when we've acquired that community those community spread cases, those cases that we cannot track. That really gives us an indication there is a broader exposure in the community to coronavirus that we can presently test to confirm. And so that's why Omaha has a directed health measure from both Douglas County and then in the broader area from the state, because we believe that even though we've got a certain number of cases have tested in, say, Douglas and Sarpy and Cass and Washington County, we believe that there are more cases there, and that's why we've taken more restrictive measures. And when we have that indication in other parts of the state, we will have more restrictive measures, and typically we will do that for 6 to 8 weeks. So that's kind of how we're thinking about all this. So we don't know exactly when the cases will peak, and we don't know how fast this may move through our community. And frankly, one of the things we are trying to do is slow it down so we don't overwhelm our healthcare system. We want people, if there are people who are going to need to go to the hospital, like our patient one, we want to spread that out as much as possible so that our hospitals can take those people, treat them, and help them recover. So, frankly, folks, again, I think that we should have a longer frame thinking about this. It will not be the same all across the state, right? In our more rural areas, it may reach there slower than it has in Omaha and may in Lincoln. But I think we got to have a long-term philosophy about, when I say long-term, this is going to be going on for the next several months. Probably in one part of our state or other, we will probably have some limitations. I can't tell you exactly what those might be because it will all depend on what, we'll work with our experts at UNMC to figure out what that might be and how tighter restrictions have to be to slow the spread of this virus down. But, I think that, Commissioner, when you're saying, plan to operate the rest of this school year on the, schools operating without students in them, that's probably the most likely scenario.
Yeah, I
And
agree.
Matt, if I could just add on to what the governor just said, and you can correct me if I'm wrong, Governor, or even Pat Lopez, if you're still on. The 6 to 8 weeks came from just studies that were done back in 1918 when the Spanish flu was here in the United States, and mainly derived from data shown from two cities, Philadelphia and St. Louis, one that did and one that did not basically do these isolation methods, and which showed a huge decrease in so-called flattening that curve of where you saw these spikes. And the reason for flattening that curve again is to allow us to treat as many patients as we can in the hospital setting so that we don't overdo the healthcare facilities. So that's the reason for the 6 to 8 weeks, the way I understand it. And like the governor said, we're gonna as we expand testing, we're gonna see more positive cases. But then in effect, you have to say, why does that even matter? We know we're going to have more patients that are going to be positive, but the real reason to test them is so that we can get the people that need to get back into the workforce as soon as possible.
Yeah, so thanks for that. I see like a couple more questions that maybe it'd probably take us to the end of our time. One was like maybe kind of back to the, how are we as a state kind of dealing with our state lines? I mean, I admit I can see what's happening in Colorado, but I think Kansas is starting to grow now. I think at one point I didn't think they had that many, and I looked and they're kind of maybe more than us right now. And I don't, again, Gary, as you mentioned, one of those cases kind of across the South Dakota border. Any sense of what we should be watching for in those other places?
Well, to a certain extent, it's hard to know because, again, it depends on the availability of testing and how many cases they really have. I think for us, especially for our communities along borders with other states, certainly the public health officials should be paying attention to what's going on directly across the border. And that's where, again, we're going to be monitoring. And if the public health officials, for example, think that they're at greater risk and they want to talk to their local healthcare officials about saying, gee, we want you, when you're thinking about doing testing on people, if somebody's been to Denver because they've got lots of cases there and they've got community spread, and by the way, I don't know if that's true or not, but that could be a scenario, that might be added to the case of why somebody might be tested. So what we're really looking for, though, is local public health officials keeping a good eye on what the local conditions are and being able to communicate that back to the state public health folks and really and their local healthcare providers to keep an eye on what's going on specifically in their region.
Yeah.
And Governor, this is Pat Lopez, and that's exactly what's happening in our area, and that ongoing communication. I appreciate you pointing that out because there can be variations between communities, and it's important for us to respond based on what's happening in that community.
So number one, I just appreciate everybody's kind of time, and we'll address some more questions on specifics around. I know maybe we got some on Rule 10 and what to do with senior year. I probably can't do those justice right now in the time that we have. I think there's some questions about Title I that we'll look at a little bit closer, and some areas like that. Hey, I understand there's probably lots of different folks on this call. What I want to just say to everybody is this is about trying to have honest conversations about what's happening and what's really important for the state of Nebraska and for that health for everyone. And so I just kind of appreciate that people that would join this call would be using it for that purpose. And I want to say to folks that there's a lot of dedicated work going on, a lot of people that care about the state of Nebraska, the governor, our legislators, myself, all of you. It's really us working together that's going to be critical to actually address this. I'm actually very worried, right, for the state of Nebraska that we do this well. I've appreciated the levels of partnerships that we've had and continue to have. And I just want to tell everybody how proud I am of us trying to do that right work. And I want you to be encouraged by that. I want folks to be pulling together in the same direction. I think that's important. I just think it's critical that we do that. I thank you, Governor, for doing that particular work. I thank Gary. I know Gary and I are probably texting each other at 3 o'clock in the morning more than Gary ever wanted to text me at 3 in the morning before.
Oh, no, you text me. I never text you at 3 in the morning.
Oh, okay. I see how it is. Okay. No, I mean, I'm very proud of the efforts going on. I want folks to know and understand that. There's, I'm going to say there should not be politics in these moments. There should not be us trying to one-up anybody. This is all of us together, and I just appreciate what you're doing. So thanks a lot. I just saw Jake from State Farm is who I'm talking to on the message. But thanks, everybody. I'm going to go ahead and end this and just appreciate what everyone's done and how much critical work has taken place across the state. And we got a lot more to do. We're just starting, I think. So thank you to everyone for your efforts.
Thanks, Matt.
And Matt, if I could just echo that as well. Yeah, thank you very much. We really appreciate the great close working relationship we have with you and the Department of Education. You folks have been great, so really, really appreciate that. And folks, we got a lot of tough times yet ahead of us. There's going to be a lot of work for all of us to make sure that we're taking care of the kids and the families in the state. But I know that working together, we will get through this just like Nebraskans always do by getting through it together.
Thanks a lot. Thanks, Governor. All right, we'll sign off and get to work again. I always feel like the work just starts after these calls somehow. So thanks a lot. Thanks, everyone.
Well, yeah, I think you just put the message out. We're continue e-learning. We're closed indefinitely, and then we'll just continue to figure out what we need to do.